two characteristics which describe my workplace right now, because I have not done my field placement yet, would be positions in the organization are grouped into hierarchy, and positions reflect a high degree of education and specialization. So I'm in the military, and as it describes in the bureaucratic theory, it specifically usually applies to a military type structure. So within the organization and the place that I work, rank plays a big factor in almost everything that we do. You have your enlisted, and then you have your officer corps. So the enlisted are going to be kind of the individuals who do like intakes and gather patient information, and then your officers are the people who actually deliver the therapy to the individuals within the organization. You usually have lieutenants through majors, and those are the ones you're going to have to be licensed as far as social workers go. And for the psychologists who work in my office, you have to have a doctorate. So there's a huge hierarchy in the positions within the clinic that I work. And according to so they're challenging in a way that you could have an enlisted individual who has the same amount of years in service as an officer, but because of the difference between the enlisted and officer corps, sometimes there's a power struggle on who knows more information and who kind of knows what's best for the patients in that environment. What stage of the tribal leadership do I think that my organization is in? Currently, I would say we are in the third stage, which is I'm great, you're not. I think that we kind of stay in this stage because the environment that we work in, you want to be high energy, you want your patients to kind of know and feel that energy, but at the same time, there are a lot of rules and structure that fall within working in that military setting. So it's hard to be a we all of the time when everything falls on an individual's shoulders, depending on what's going on in the clinic at a given time, or if one specific patient is struggling or one specific patient does something, it falls on that provider, and there's not a lot of we when it comes to that because of big Air Force and not just our small clinic.